How soon can you take a pregnancy test? In this video we discuss the best time to take a pregnancy test and how soon after missing your period should you consider taking one. Subscribe to the channel for content on women's health and lifestyle tips. You are at risk of pregnancy if you had unprotected sex or had a high risk of sperm touching your genitals. The level of risk varies over the course of your cycle. Sperm exposure towards the beginning or the end of the cycle in general poses less risk of pregnancy because it's less likely that a person ovulated close to or during those times. The best time to take a pregnancy test is after your period is late. This will help you avoid false negatives and the false positives of very early miscarriage. If you're not already keeping a fertility calendar, proper pregnancy test timing is a good reason to start one. The best time of day. The time of day you take a pregnancy test does matter to a certain extent. You're more likely to get an accurate result if you take the test in the morning. This is especially true if your period is not yet late, or if your period is only a couple days late. If you don't want to wait until you've missed your period, you should wait at least 1 to 2 weeks after you had sex. If you are pregnant, your body needs time to develop detectable levels of hCG. This typically takes 7 to 12 days after successful implantation of an egg. Here are some signs that you should take a pregnancy test. 1. You've missed your period. One of the first and most reliable signs of pregnancy is a missed period. If you don't track your cycle closely, it might be hard to determine whether or not you're late. Many women have a 28-day menstrual cycle. Consider taking a test if it's been more than a month since your last period. Keep in mind that your period can sometimes be delayed or skipped due to stress, diet, exercise, or certain medical conditions. Also pay attention to your flow if you suspect pregnancy. It's common to experience light bleeding or spotting in the early weeks as the egg buries deeper into the uterine lining during implantation. Take note of any difference in the color, texture, or amount of blood. Contact your doctor if you have bleeding and a positive pregnancy test. 2. You have cramps. Implantation can also produce a feeling similar to menstrual cramps. In early pregnancy, you may feel this discomfort and think your period is just around the corner, but then it never comes. Sound familiar? Take a test. Hormone levels vary by woman and by pregnancy. 3. Your breasts hurt. As your pregnancy produces more and more estrogen and progesterone, these hormones start to make changes in your body to support the baby's growth. Your breasts may feel tender and appear bigger due to increased blood flow. Your nipples might hurt and the veins might look darker under the skin. Because many women also experience breast discomfort in the days leading up to their period, this symptom isn't always indicative of pregnancy. 4. You're feeling different along with cramps and sore breasts. Early pregnancy can cause nausea, food aversions, exhaustion, frequent urination. As the weeks go on, these symptoms may get stronger before your hCG levels even out late in the first trimester. You know yourself, so pay attention to your body. Any unusual physical symptoms could prompt you to take a pregnancy test. 5. Your contraception failed. Birth control pills, condoms, and other types of contraceptive devices don't provide 100% protection from pregnancy. In other words, there's always a slight chance of pregnancy, no matter how careful you are. Despite your birth control preferences, consider taking a test if you experience any of the signs we've listed. Human error or defects can also result in unplanned pregnancy. Birth control pills can be difficult to remember to take each day. According to Planned Parenthood, 9 out of every 100 women on the pill will get pregnant if they don't take it as directed. Condoms can break and tear or otherwise be used incorrectly. According to Planned Parenthood, nearly 18 in every 100 women relying on condoms for contraception get pregnant each year. If you're worried about contraceptive failure, ask your doctor about alternative contraceptive methods, such as an intrauterine device (IUD). According to Planned Parenthood, less than 1 out of every 100 women using an IUD gets pregnant each year. When in doubt, test. Sexually active women in their reproductive years have a chance of pregnancy every month, even when using protection. There are certain signals your body might send that should prompt you to take a pregnancy test. For the best results, take the test after you think you've missed your period. Test during your first morning bathroom visit, or hold it for several hours to increase the concentration of the HCG hormone that the test measures. Testing early helps to ensure that you get proper care for yourself and, if applicable, prenatal care for your baby. In the event of a positive result, contact your doctor as soon as possible to discuss your options and potential next steps.